Okay, go.
All right, so I'm going to do the medical assessment today on a patient here. I'm going to set this timer to 15 minutes. And so when this goes off, you'll know that it was 15 minutes. So I've been called to the scene, or I've been called out for a patient, a 64-year-old male, experiencing chest pain and nausea. And I just arrived on the scene. I've taken my standard precautions. And I'm assessing the scene for safety, looking around the environment.
Patient is alone.
A patient is alone. Is the scene safe?
The scene is safe.
The scene's safe. I've got one patient. Based on what dispatchers told me, and what I can see as I approach the patient, he's sitting on the tailgate of his pickup truck. I can see a shovel on the ground. He's sitting up there. He's holding his chest. He's obviously in some pain. So I can determine that that this is a medical call. So determine that it's the nature of illness medical call. The nature of illness is chest pain. So I'm approaching the patient closer up. We've determined it's one patient. The proctor already told me it was one patient, and
he's responsive.
He seems responsive. He's obviously awake. We're about to determine his level of consciousness now, or alertness. But I'm approaching the patient. There's no signs of obvious trauma. Is there any reason that we need to take C-spine precautions for this patient?
No, not at all.
So we don't need any C-spine precautions for this patient. Looking him up and down. Don't see any trauma. I'm going to go ahead and make my general impression right now. The patient is 64-year-old male. Responsive, but probably expecting him to be maybe unstable, with chest pain. And that's my general impression of the patient as I approach him. So now I'm up here to talk to him. Hey sir, how you doing? My name is John. I'm with EMS Services. I'm with the ambulance. What'd you call us out here for today? What did we come out here for today?
I was working in my yard and I was digging a hole, and I all of a sudden started suffering pains in my chest, and it scared me, so I called.
Sure, absolutely. Do you so now we've established the chief complaint is chest pain, and so hey sir, I'm gonna ask you a few questions. Do you what is your name?
My name is John.
Okay. Do you know what day of the week it is?
It's Sunday.
Sunday. Okay. You know where we're at right now?
I'm sitting on the tailgate of my pickup truck.
Okay. Do you know how this whole thing started up?
Well, I was just digging a hole with my shovel, and I just probably overexerted myself, and I just all of a sudden started hurting, and I just had to stop.
Okay. So just to ask the proctor, is there any signs of life-threatening conditions, major bleeding, airway blockages or problems, cardiac arrest, anything like that needs
No
to be addressed
major
immediately?
bleeding observed. Patient is talking fluently, answering questions correctly. Go ahead and proceed with your assessment.
Okay. And so the patient is alert and oriented ×4. And sir, is it going to be all right for me to continue to treat you today? I'm going to have a few more questions and check some of your vital signs. Okay. So I'm going to start by checking your respiratory, your breathing. So we've already established your airways patent, so we're going to check your breathing. So I'm going to put my hand on your chest, and I'm going to look at my watch, and we're going to time your respirations for 30 seconds, and then multiply that by 2. I think. So, and while we're doing this, we're watching for the rise and fall of the chest for tidal volume, quality, quantity, equal bilateral movement of the chest. All right, so I believe his respirations are at 16 breaths per minute. All right. So now we're going to check his oxygenation.
Okay.
So I got an SpO2 monitor here. We're going to put that on. And I'm going to check his circulation. So we're going to do his pulse, his radial pulse. And his pulse is tachycardic and thready. All right, so now we're going to check his skin condition. And actually, I'm going to go ahead and take your blood pressure, sir.
Okay.
So if you could just, is that on right?
Yeah.
So just go like this,
Hit the button.
and I'm going to hit the button for you. All right, so I'm going to check the condition and color, temperature of his skin. And it appears cool, moist, and clammy.
Yeah.
All right, and so now I'm going to start asking you a few other questions and moist, okay? So I believe so far, I'm waiting for the rest of his vitals, but I would say that this patient, based on what I already know, respirations, his of 16, his tachycardic and thready pulse, his skin color and condition, and temperature. He's going to be a high priority patient, combined with his chest pain. Okay, so the patient's blood pressure is 145/75, and his pulse is 56,
Yes.
or 55, 56, and he's at 97% SpO2 on room air. So, why are you handing this to me? You keep that. You're supposed to be telling me what your vitals are.
You're doing perfect.
Okay, so we've already established this is going to be a high priority patient. A high priority patient. So now I'm going to start my rapid secondary assessment because he's high priority. We're going to start that with OPQRST and sample history. So, sir, hey, sir, when did these symptoms, when was the onset of these symptoms?
It probably about an hour ago.
Sure. Okay, was there anything that makes them better or worse?
Rest.
Rest?
If I just sit down and rest, that seems to be the best.
Yeah, can you describe it for me?
It was pain across the chest, a little bit down one arm, and I just I had to stop digging the hole I was digging and just sit down on the tailgate of my truck.
I bet. Absolutely, I bet it. Yeah. QROPQR. Does it radiate anywhere across your chest? Does you feel anywhere else? Or?
Not really.
Not
It
really?
just, like I said, maybe a little bit down my arm.
Yeah.
But,
Is there, so if you had to rate this pain on a scale of 1 to 10, with 10 being the worst, how would you rate
I
it?
would have said about a 7 at the
About a
time.
7?
At the worst.
And about how long ago did this start? What time
That
did it
was
start?
about an hour ago, and it's settled down some since then. But
Sure. Okay. So we already know the signs and symptoms. We've already kind of been over that already. So are you on any allergies?
no, none that I know
Yeah.
of.
Why don't you lean up for me and we'll listen to your lungs while we're going over some of these questions.
Okay.
So no known allergies.
No.
And you can breathe deep for me. Are you on any medications?
I've taken 2 nitro pills.
About how long ago was that?
It was when the pain first hit.
And do you have any past medical history?
About a year ago, I had a heart attack and angina.
All right. And when was the last time you had anything to eat today?
It was a couple hours ago. I had breakfast. It was eggs and bacon and toast and coffee.
Yeah. And all right. So his lung sounds for, does it sound there?
It just says no crepitus or
Crepitus or,
flail segment found.
sure. Okay, well, great. Well, so we're gonna do a,
Lungs are clear.
lungs are clear.
Yeah.
All right, so we're gonna go ahead, I'm gonna go ahead and check your eyes. We're gonna pretend this is a pin light. So I'm gonna go ahead and start the systems assessment. We're gonna start with the eyes and we're gonna work our way down.
Okay.
So go ahead and follow the light with your eyes. All right, pupils, don't move your eyes, not your head. Pupils are equal and reactive to light.
Okay.
All right, so I'm gonna go ahead and just touch your chest real
Okay.
quick, and we're gonna. Can you point to where it hurts?
It was just right in
Yeah,
here.
just right in there. You mind if I touch there?
Go ahead.
Is there anything that makes it worse, or does that make it worse
No.
about it?
No difference.
Sure, I don't want to hurt you, so let me know, okay?
Okay.
All right, so we've already checked your lung sounds. Is there?
You're gonna do vitals again.
And let me do your vitals again. Is there? Now we're going to check your musculoskeletal reaction. Go ahead and hold your arms up for me if you can. Yeah. Can you go side to side? And can you go up? So it's now musculoskeletal. All right. And you had any problems with nausea or vomiting lately?
No, I've been good that way.
Okay. Are you spitting up anything? Maybe anything pink and frothy or?
No.
Yeah. Okay. Good. So we've gone over his. We've checked his chest for crepitus. We've checked for lung sounds. We've checked his pupils. We've checked musculoskeletal. We've asked about his gastrointestinal. Do you have any problems going to the bathroom or anything? Either one or number two?
No.
So we've talked to him about those things. So we're going to check his vital signs again. So we're going to run his blood pressure again. So go ahead and bring that back in. He's got the pulse oximeter on. I'm going to go ahead and check his pulse. So if I didn't say it earlier when I classified this patient as a load and go patient, a high priority, we would have loaded him onto the ambulance right then and there, and we'll be doing this inside the ambulance.
Yes, sir.
Have him loaded on the cot. He's just slightly inclined at a 45-degree angle, so he's sitting up just a little bit. And so I've got his pulse, his blood pressure. His pulse oximetry is actually is pretty alarming. It's at 93%. That's actually a problem. In reality, according to the class, you're back up to 95. So, so we're taking blood pressure, pulse. We're going to check your respirations again. Blood pressure, pulse, SpO2, respirations, and they're still at 16. And I'm going to check his color, condition, and temperature.
We've only got about a minute left.
All right. So my field impression of the patient is that he is having a cardiac event, and that this is serious. So for the patient, what I'm going to do is my standing orders. I can start treating him for shock. So I'm going to keep his clothing loose. I'm going to cover him with a blanket. I'm going to also ask him a few questions about his medication. He said he's already taken 2 doses of nitroglycerin. That was 10 minutes ago, I believe is what he said.
Yeah.
So are you sure you on any other medications for blood pressure or for maybe Viagra or similar products?
No, just baby aspirin.
Just baby aspirin, okay. Do you have any gastrointestinal problems? History of that?
No.
Okay. So he doesn't have any contraindications for the medications. I've checked the bottles. He's got his bottles right here. So they are for him. They're not expired. It's the right medication at the right time for the right patients, and it's going to be 0.4 milligrams of nitroglycerin administered sublingually, and 325 milligrams of baby aspirin. So it's like 4 tablets. So if I call medical direction, I'm going to let them know what the situation is. Hey, I've got a 64-year-old male patient complaining of chest pains. These are his vital signs. I've taken 2 sets. He is prescribed, has a history of angina, and has had a heart attack in the last year. He's prescribed this medication. I'd like to go ahead and administer him a 3rd dose of nitroglycerin and a dose of 325 milligrams of baby aspirin. So I'm out of time. I'm just going to keep going anyway. Who cares if I'm a minute over? So that's how I'm going to treat the patient. I'm going to continue to reassess this patient every 5 minutes on the way to the hospital, and then I'm going to take his 3rd set of vital signs. So we're going to do his blood pressure again. So go ahead and pull to your chest, pulse oximetry, pulse. I don't want to go too far over because I have to email this to myself and then upload it to a lot. All right, I'm going to check your respirations. It's fine. So we've taken a 3rd set of vital signs from the patient, and so I could get ready to do my handoff. That's either at the hospital or to other ALF, advanced life support. And basically what I'm going to tell them, hey, we've got a 64-year-old male patient. We were suffering. He's presenting with signs of a cardiac event. These are his vital signs. I'm going to give them the information on all 3 sets of vital signs. I'm going to tell them about the interventions that I've given him for both standing orders, treating him for possible cardiogenic shock, and then the application of the nitroglycerin. We've given him 3 doses this far apart, this much, and the baby aspirin for this much and this much. And that about covers it. So I appreciate you guys for helping me.